Hello, I'm Dennis Stokley. I've been an independent insurance broker here in Wilmington since 1986, which has been about 33 years. I specialize with Medicare coverages as well as offer individual health insurance, which is the Obamacare, and group health insurance as well. Wilmington is my home. I was born downtown at the James Walker Hospital. My agency is the Dennis G. Stokley Insurance Agency here on Oleander Drive. I'm right down from Jungle Rapids, and I'm also located next to the Wilmington Gastroenterology Doctor's Office. So with that in mind, let's go ahead and start the Medicare benefits overview. First, we're going to start off with who is eligible for Medicare and what are some of my coverage options. This is Medicare 101 that we're going to be covering. So to begin with, who is eligible for Medicare is for anyone that is a U.S. resident or has lived 5 consecutive years here in the United States, but primarily they're those individuals that are age 65 and above. Now we do run into a few individuals that are under the age of 65. They have qualified for Medicare after being on Social Security disability for a period of 2 years. So there's a lot of people and individuals that are under 65 that are able to get onto the Medicare program as well. And of course, any age is those individuals that have been diagnosed with end-stage renal disease or with ALS. So let's go through some of the Medicare coverage options. Once you decide to enroll in original Medicare, you'll look on the left-hand side of the screen where you'll see the original Medicare and the red, white, and blue Medicare card. Medicare is set up into 2 parts, Part A and Part B. Part A covers your hospital coverage, and Part B is your physician coverages. The red, white, and blue card that you'll see on the screen there now has new numbers and letters as your ID card, because for many, many years since the program has been set up, they'd always use your Social Security number, and they felt like it would finally be a good idea to get that off of a card and out of your wallet. So they went to the new format that's just been implemented a couple years ago. So once you decide to get enrolled into original Medicare, then you need to decide whether or not you want to add additional coverages to cover all the gaps that are not covered by Medicare. So in this screen, you'll see that option 1 would be with going with a Medicare Supplement plan. Those plans are offered by private insurance companies, and it'll pay some of the and most of all the out-of-pocket expenses that Medicare does not cover. But you also will have to add a Part D prescription drug plan to that, because Part D Medicare does not cover drug coverages under this program. So that would be another separate policy that you would have to add to this program. Now your second option would be a Medicare Advantage plan. Those plans are also offered by some of the same insurance companies that offer the Medicare Supplement plans, but they will combine all of the coverages together. It'll combine your Part A, your Part B, your Part C, and it's also called Part C as far as Medicare Advantage. And it does also include your prescription drug coverage within that one policy. Additionally, there are more benefits added to Medicare Advantage plan that are not covered by regular Medicare. And this would be vision, hearing, dental, gym memberships, and a lot of other types of benefits that are not presently covered by Medicare. So let's take some more details and get into Medicare as far as what's covered and what's not covered. First off, I mentioned that Part A would be your hospital insurance coverage. That would cover hospital coverages, primarily your hospital care, your mental health care, skilled nursing facilities, hospice care, and some blood transfusions are covered under Part A. Now your physician coverages are provided under Part B, and that would cover for outpatient hospital services, ambulance, lab services, wheelchairs, durable medical equipment. Some preventative care is also provided under your Part B coverage with Medicare. Now let's get into what's not covered by Part A and Part B. Part A and Part B have deductibles, co-insurance, and premiums that some people have to pay. There's also with Medicare Part B, there's also excess charges that the physicians are able to charge above what Medicare allows. Medicare does not cover prescription drug coverage, and certain other items like hearing, vision, dental is not covered by Medicare. And of course, long-term and custodial care is not covered by Medicare. You're covered for up the first 90 days, I believe, with the Medicare coverage in a nursing home, but that is only if your health is continually improving. So let's dig a little bit deeper into those costs of Part A. The premium for a Part A is $0 for most people. You do have a deductible for the hospital deductible, which is $1,408 per occurrence. And keep in mind that this is a per occurrence, it's not a calendar year deductible. So you could break a leg one day and pay a $1,488 deductible, and 3 months later break your arm, go back into the hospital, and you'll have another $1,408 deductible that you would have to pay. Then there's other costs such as $352 costs per day that you're in the hospital from day 61 through day 90. And then you've got a $704 copay that you would have to pay if you have go over those 90 days and you have 60 reserve days. Also note that there's no out-of-pocket limits. So if you have a situation where you have $100,000 worth of medical expenses and you'd have to pay $20,000 as your co-insurance, then that would be a very expensive proposition, which would apply with your Part B coverage. Your Part B coverage, of course, is $144.60 per month for most people. Those individuals that have a higher income will pay premiums up to $461 per month. Now, to make things even less confusing, these plans, Part B has a deductible of $198 per year. So you only have to meet that deductible one time per year. But here is also, there's a 20% co-insurance where Medicare would pay 80% of your bill and you would be responsible for the other 20%. And once again, there's no out-of-pocket limit available for Medicare. So now we can look at your two options to fill in some of those gaps. Your option number one would be to go with a Medicare supplement plan, which would pay most of all the out-of-pocket costs. And you would also have to add to that a Part D drug plan. Your second option, of course, would be to choose a Medicare Advantage plan. That would be called your Part C coverage, and that combines your Part A, your Part B, your hospital, your doctor charges together, and they usually will include prescription drug coverage as well. And also other benefits like hearing and vision that are added that are not automatically covered under your Medicare coverage. So let's go into a little more detail with the Medicare supplement. It's also known as Medigap policies because it kind of fills in the gaps where Medicare does not pay. It's offered by private insurance companies. You still have to pay the monthly premium, that $144.60 each month. Additionally, that you would have to pay in addition to whatever the premium would be for your Medicare supplement coverage. Now, to be eligible for a Medicare supplement plan, you must be enrolled in Parts A and B. You must live within the state in which that policy is issued. You have to be at least age 65. Now, there are a few instances where you can be under the age of 65 and apply for a Medicare supplement plan, but those will usually run $800–900 per month, and it's quite expensive to be under the age of 65 and get a Medicare supplement plan. I also wanted to mention that at age 65, when you first enroll into your Medicare supplement plan, those plans will usually run maybe a little over $100 a month, but they will go up each month as you get older. And by the time you reach 80 or 90 years of age, then your premium will probably be $300 to $400 per month. Your Part D coverage would be covering your prescription drugs, and they are also offered by some of the same insurance companies, private insurance companies that offer your Medicare supplement coverage. And once again, you must also continue to pay your Part B premium. Part D coverage for prescription drugs, these drugs are covered by a formulary that's issued by these insurance companies. So you need to really check those formularies and check the prescription drugs that you're taking to make sure that those items are covered under that current plan that you do select. There are, for this year, I believe, about 28 different plans in North Carolina that you can select for your Part D coverage. But this is tiers 1 through 5 as far as your formularies. So your generic prescriptions are going to be tiers 1 and 2, with your specialty drugs being in tier 5, which will be the more expensive prescriptions. Now, these drug coverage plans, they will vary from plan to plan and from year to year. You do have catastrophic coverage that will cover you if you have some very high prescription drug costs. But keep in mind, your prescriptions may change each year. The benefits will change each year. So you need to kind of really stay on top of these Medicare Part D plans in order for year to year, in order to be continuously covered. The enrollment would make sure that your drugs are covered before you enroll in the plan, because as I mentioned before, the list of drugs can change from year to year. There's always new drugs coming out each year that are automatically covered. But for Part D, coverage is not automatic. You do need to select your own plan when it's first available to you, at age 65 perhaps. If you do not select a plan and go without your Part D coverage, then when you do select coverage 3, 4, 5 years down the road from now, you'll have to pay a penalty. And that penalty is usually 1% per month for every month that you go without that coverage. So if you go 4 years without coverage, then you're going to have a 48% surcharge penalty to be added to your new Part D plan. Now, your prescription drug costs, they're available to you, and the coverage is in 4 separate stages. You have an annual deductible stage, initial coverage stage, coverage gap stage, which is also known as a donut hole, and then you have a catastrophic coverage stage. So your prescription during the year is going to cost a different amount depending on which stage that you are currently in. Now, fortunately, the insurance companies will send you a quarterly or a monthly statement to tell you exactly what stage that you're in. But the other good thing about this is that most people, and the way this plan was designed, is that most people will stay in the initial coverage stage for the entire year and not actually get into the coverage gap or the donut hole. But once also, it will start over on January the 1st of each planned year, and it'll reset at that time. This is a little bit better slide that I really like. It kind of shows you the 4 different stages, starting with your deductible stage, which would be, some plans do not have a deductible, so it might be $0. Other plans have a $435 deductible. That would be the stage in which you would pay the full cost of the drug. And then once you meet that $435 deductible, you go into the second stage, which is your initial coverage stage. And at that time, you would probably pay a copay that's already set up by the insurance plan, be it $10 or $20 or $25 for that prescription. Now, once you and the insurance company have spent $4,020 together, then you will go into the coverage gap, in which you would pay 25% of the cost of the prescription. Then once you have gotten an out-of-pocket limit of $6,350, then you would be able to be eligible for the catastrophic coverage, whereby you would only pay 5% of the cost of the prescription, or a $3.60 up to $9 copay for each prescription until you run out at the end of the year. So once again, we've got those 2 options. You've got option 1, which is your original Medicare with Medicare Supplement coverage and Part D coverage. The Medicare Supplement plans will usually run close to maybe $100 or so when you first start at age 65 and go up from there. Your Part D coverage will run anywhere from $15 a month up to $100 a month, but you really do need to check your prescription drugs to select the plan based on what prescriptions that you take, and not necessarily take the least expensive plan to cover you. Or option 2, go with a Medicare Advantage plan which is called Part C coverage, which combines Part A and Part B, your physician coverages, and can include your Part C and Part D coverage, your Part D being your prescription drug coverage, and then there's other benefits that we'll outline to you as well, based on the company that you go with. So your Medicare Advantage plans, let's kind of go over those as a different avenue here. As I mentioned earlier, it combines Part A and Part B, and some plans include prescription drug plans coverage, but not all. It's also offered by private insurance companies, and it also has routine vision coverage, hearing coverage, wellness services, and perhaps even a nurse phone line support, in addition to a gym membership. To be eligible for Part C, you once again have to be enrolled in Parts A and B. You must live in the plan's service area, which in this case, it goes by county by county. So New Hanover County, for perhaps, will have different plans that are not available in Pender or Brunswick County. It's a county by county selection. Eligibility for these plans is not based on any financial information or your health. This guaranteed issue. And of course, a lot of the plans that we have with Medicare Advantage have a 0 monthly premium. Now, this last bullet point says you must not have end-stage renal disease. That's currently for 2020. I believe as for the plan year of 2021, that criteria is going away. And so individuals with end-stage renal disease will be eligible for a Medicare Supplement, Medicare Advantage plan. Some facts that we have for Part C. Once again, the plan premiums and terms can change from year to year. Insurance companies always will send out an annual notice to you prior to the renewal date. At that time, you'll be put on notice as far as what the new year plan will cover. But one of the great things about these plans is all your coverages are together in one plan. You have one ID card. You've got your prescription drug coverage included in this. You do perhaps will have to follow a network and see the network doctors and the network hospitals, but quite a few, most all of the doctors are pretty much within the plan or in the network. And like I said earlier, that it covers a lot of other items with Medicare does not cover, being dental, vision, hearing, and some preventative care that's not covered currently by Medicare. There are a few different types of Medicare Advantage plans. There's an HMO plan, which means you must see the doctor in order to get full coverage for your services. If you go outside the doctor network, you pay for everything on your own. A lot of people like the PPO, the Preferred Provider Organization, which means you're covered under the network doctors, but if you go outside of network, then the situation would occur that you would then be covered, but you'd perhaps pay 50% of the cost of that service. There are special needs plans called SMP plans. Those might be for those that are on Medicaid, North Carolina Medicaid, or perhaps have chronic illnesses that are better suited by certain special plans provided for Medicare Advantage. We also have private fee-for-services, not many of those in this area. There's also one other plan that's called a medical savings account plan, an MSA plan, which comes with a high deductible of perhaps $5,000 that you would have to spend if you had medical services. But the insurance company automatically puts $2,000 into your medical savings account for you to spend. So if you go through 2, 3, 4 years without any major medical, then your medical savings account will exceed that $5,000 deductible, and you will be fully covered for any major expense. And we'll be happy to review that in further detail with you at a later moment. So let's go into when can I enroll? There are special times that you can enroll into these Medicare Advantage plans. Our annual enrollment period is coming up starting on October the 15th, or started on October the 15th. It runs to December the 7th, which is Pearl Harbor Day. And that is the time that you can change plans or enroll into a Medicare Advantage plan for the first time if you are on a Medicare Supplement plan. And all these plans will be effective on January the 1st of the following year. Now you can also enroll in your initial enrollment period, which is an IEP, when you first become eligible for Medicare. And that's going to be a 7-month period that starts 3 months before you turn 65, the month of you turning 65, and then 3 months after you turn 65 is going to be your initial enrollment period. And that graph up on the right-hand corner there shows your initial enrollment period that shows 3 months prior, the month of, and 3 months after would be your initial enrollment period. You also will have a special enrollment period during the year if you perhaps move out of state or there's other different situations where you can enroll during the year and not wait until the annual enrollment period of October the 15th. But everything will be effective on January the 1st of the following year. During your initial enrollment period, of course, now if you enrolled in your birthday month, then your policy would start the 1st of the month of the following month. So if your birthday was June, the new plan would start July the 1st. So that kind of wraps everything up. We're now going to go to a few questions. If people would like to ask a few questions, we'll be available to take your questions.